into ideas and strategies that might give rise to broad-scale systemic change. Those of us in philanthropy are much better at creating these pilots, generating these existence proofs, and testing the efficacy of things. We're wholly unsophisticated at promoting systemic change, and we need a lot more discourse about how to pull that off. Hence, I think the importance of both Phyllis's and David's questions. Thank you again for having me.
Thank you, Kent. So next, Terri Wright is going to speak to us, and she's the director for the Center for School Health and Education at the American Public Health Association.
Thank you very much. So I'm used to being last with the last name of W. So hopefully I can keep you going for our discussion that I'm looking forward to in a little bit. I'd like to start by saying thank you to the Roundtable for allowing me to bring public health to this table and to your discussion today. I think that it hasn't been as pronounced as perhaps is needed when we think about what the issues are that are faced by young people, and when we think about the social context that Steve so eloquently elaborated on earlier today, which falls squarely into the lap of the public health sector. And sometimes we mix public health and population health and health care all together, and I suggest to you that they have distinctive roles that are complementary, and that one's an outcome and two are processes and products that can lead to that outcome. So what I hope to do is share some of that with you, along with how health and education, with an insertion of public health, can work together for common goals. Now let me just see here now. Okay, this must be, okay. A little bit about the Center for School Health and Education. We were established in 2010 at the American Public Health Association with a primary focus on dropout prevention and elevating dropout prevention as a public health priority. We have a policy at APHA that speaks specifically to public health and education, working collaboratively across sectors to improve high school graduation as a means to eliminate health disparities. The center also serves as a focal point for that work to happen, for it to gel and become operationalized. And we are fortunate to have, for the first time in Healthy People 2020, a health policy document. We have an educational achievement objective, specifically speaking to high school graduation. And it's explicit in that it says, in 4 years after starting 9th grade, graduating on time with a regular diploma. Very, very specific and significant in that we are acknowledging in health that high school graduation is paramount if you want to change the trajectory of health in adults. So the center forms the nexus for that work to come together and be operationalized by, first and foremost, it's not moving, understanding why high school graduation matters. And I don't think I need to spend much time on this. You've heard it over and over and over again today. And I think that by virtue of being the last speaker, what happens is that you might have a little bit of redundancy, but anybody who knows me knows that you have to hear it 7 times to make a difference. So we're going to go real quickly. We know that there's a shorter life expectancy for dropouts. We know that they're more likely to suffer from chronic illnesses. We know that they earn less money, less likely to be have health insurance as an adult, and also that they are less likely to have social conditions that promote health as an adult as well. So for children and adolescents, we know that health and education are 2 sides of the same coin. We can maybe separate that for adults, but for children and adolescents, we know, and we've heard it over and over and over again today in different ways, you can't learn or be educated if you're not healthy, and you certainly won't be healthy if you're not educated. At this point, for this population, we know that they're the two sides of the same coin. And you also heard, and we believe at the center, that you can make a difference for all youth through school-based healthcare, because schools are the only institutions that can reach nearly all youth. They are in a unique position to improve both the education and health status of young people throughout the nation. So for us at the center, we advance school-based healthcare as a comprehensive strategy for preventing school dropout and improving graduation rates for the K-12 population as an interim step towards adult health. That's the role that we play within the American Public Health Association, again, representing the concentrated effort for this body of work. Why school-based health centers? Because they have a track record of dealing with the social circumstances associated with educational success. And I'm going to talk a little bit more deeply about these things that we all sort of throw in this bucket of those poverty factors, and those things that we throw into the other bucket of those contextual factors or the qualitative issues. They also have a track record of dealing with some of the social experiences associated with graduation, such as school violence. They explicitly focus on risky behaviors and the dangerous health outcomes associated with adolescence, that period of development when young people are taking risks and experimenting with different behaviors. School-based health centers have a track record on that, and I'll provide some of that information in a little bit. And they are a confidential, non-judgmental, trusted source of expertise in a school building that kids and school personnel have come to rely upon. So that's why we believe in it and advocate for that strategy. They have a track record of addressing the issues why kids are either dropping out of school or being pushed out of school. And this provides some highlight for you on, when you peel back the layers of the onion, why young people are dropping out of school. It's about half and half in terms of males and females. And for males, it's usually associated with disciplinary issues, income, meaning they have to go out and work and earn some money for a variety of reasons, poor academic performance, absenteeism, and school disengagement. And while I'm presenting them as distinct, they are often interrelated. For females, the number one reason for female high school kids is pregnancy. No surprise there. Parenting, caregiving, and by caregiving, I mean having to take care of an adult in the household, a younger sibling, or other relatives in the household that they have to be responsible for providing care to. Also having to earn income, as well as school harassment. And harassment, this is sort of a big bucket that also includes harassment on the way to school and on the way home from school. School-based health centers have a track record in beginning to peel away at this and address a number of these issues that are the social factors that push kids out from school or cause them to drop out of school. So at the center, we focus on a public health approach to addressing a number of these factors, and we see the School-Based Health Center as that trusted hub for making that happen, for identifying the factors through assessments, and then thinking through and either providing the response to those factors, or more importantly and equally important, being the catalyst to raising awareness about those issues and then bringing the resources into the school to address those address the issues that have been identified through assessments. They can address these social factors, untreated health conditions. We've talked about that, chronic and traumatic stress, aggression and violence. And by violence, I'm talking about both in the school as well as in the community. Hunger and food insecurity. We talk about this notion of obesity without recognizing that obese kids can be hungry and food insecure, and indeed food insecurity contributes largely to obesity. And so looking at it just as a clinical issue and not recognizing all of the social variables that play into obesity, we're really basically blaming the victim at that point. Homelessness and risky sexual behavior are the social factors that school-based health centers have had a track record of either addressing or identifying and having others in the school or community resources begin to address those factors that show up as in various clinical or educational indicators. In terms of, we were supposed to talk about today state and local partnerships between health and education. School-based health centers represent exactly that. From the state side, there's usually the state health and education departments that are partnered, as well as the state Medicaid agency that partners to provide financial resources, whether they be state resources or a pass-through for federal resources, directly or indirectly, to address those issues in local schools. State and health and education departments also provide guidance and or technical assistance. Some of you are familiar with coordinated school health programs that are strategies that were funded by the Centers for Disease Control, where they indeed put a person in the state health department and someone in the state education department. So that represents a collaborative, and they were expected to, and indeed performed collaboratively to address issues on the local level around kids being successful in school as well as being healthy. At the local level, because that's where the action is, locally, not at the state level, but locally, there are partnerships between local school districts and schools, school nurses who are often employed by the local school district, health agencies, whether they be a local health department or another type of health agency, health providers who actually provide the services in the school-based health center, and sometimes they are funded by large health or hospital systems, and other times they are funded by local health departments or local health agencies, or it's a patchwork of all of the above in terms of resources coming together in a collaborative way to meet the needs of children and adolescents through the schools. They also provide space for the school-based health center to live in the school building, as well as support, for example, janitorial services, electricity, heat, air conditioning, so that the school-based health center can function. They provide financial and human resources through a variety of mechanisms, whether it be reimbursement or grants or people to make those health centers work, as well as technical capacities for school-based health centers to operate. So I suggest to you that they represent a strong partnership around meeting the needs of young people. So what's the evidence on school-based health centers? First of all, they attract hard-to-reach populations, especially racial minorities and males, which is who's showing up in your data later on. They're able to reach those populations, and all of this is documented on our website. You can find the articles and the research that substantiates everything I'm getting ready to share with you. They do a better job of getting young people into services such as mental health care, providing risk assessments, and also early intervention. Adolescents were 10 to 21 times more likely to come to a school-based health center for mental health services than a community health center. Why? Because it's in the school building. It makes it easier for them to do. And I invite you to think about your own adolescent and asking them to take the trash out 5 times or go upstairs and make their bed 6 times, but yet we expect to give them a referral to go down the street, around the corner, take a bus, to go follow up on getting some services. So think about that with our own kids, and these are our kids, right? No different, and perhaps even more stressed than our kids, and we expect them to follow through on a referral. And I suggest to you that whatever they need needs to be in that school building, where it's easily accessible, can be used, and they can get back to class, and brings together that education component. Additional evidence, sexually active adolescents were more likely to accept and use contraception when provided by a school-based health center. Students, teachers, and parents who have a school-based health center rated academic expectations, school engagement, safety, and individual respect, personal respect, significantly higher than in schools without a school-based health center, and found also that the mere presence of a school-based health center positively impacts the overall school climate and learning environment. All documented on my website. You can go right there and find the articles. What are some of the indicators of educational achievement? Users of school-based health centers had decreased absenteeism, decreased tardiness, increased grade point average, and African American males in particular were 3 times more likely to stay in school when there was a school-based health center in that school. 3 times more likely to stay in school. When you look at the dropout data and who's in that dropout data, they are Black and brown adolescents. So this is a significant piece of information in terms of their ability to keep kids in school. There's also early evidence of an impact on school suspensions when there's a school-based health center in the school. So I think we have quite a bit of information to say that it's an important an important intervention strategy. I just want to share this with you because when a school-based health center does a school-wide assessment, okay, now what I'm talking about is not just serving the kids who are in the school building. I'm talking about stepping towards population health, which means you're looking at the entire population in that school, not just the users of the clinic. Very different. When you do a school-wide assessment that provides the safety for kids to tell you truly what's going on in their lives around their behaviors and their environmental circumstances, this is some of the information you can learn about what's happening in those kids' lives. This is just one school, one middle school and one high school in an impoverished city in our country, where we had 30% of middle school kids, this is grades 6 through 8, talking about being sad or had nothing to look forward to. 30% said they were sad or had nothing to look forward to. 24% carried a weapon. In high school, 35% carried a weapon. 51% in the high school had sex, and 25% of those were not using a condom or any kind of protection. So it's not if they're going to get pregnant, it's when they're going to get pregnant or cause a pregnancy. 39% missed school for work due to work, lack of transportation, or having to provide care for somebody else in the household. 28% got in trouble because of anger. This is just a smattering of what we learned when you ask them and you give them a way to respond confidentially and without adult judgment, you can learn an incredible amount about what's going on in their lives. So for example, we even asked them about homelessness. We asked them about electricity in their homes. We asked them about having running water in their home. Okay, this is when you start unpacking what we mean when we talk about poverty. That's what poverty means in the lives of these young people, not being able to take a shower or wash their clothes and having to go to school, perhaps not smelling real good and being teased and deciding they're not going to go back to school the next day because they're tired of being teased. This is what we're talking about when a principal asks a school-based health center to put a washing machine and dryer and shower in that school-based health center. That's what we're talking about when we're talking about poverty and kids going to school after not eating since lunch yesterday. Okay, that's what we're talking about in real terms. So unless we give them a way to identify that and tell their story safely, we really are missing the whole social context that education nor health will have any effect on unless you get to that social context. We call it the social factors that affect both health and educational outcomes, but we're not asking. We're not asking, much less addressing in very concrete, real ways to make a difference in the lives of these young people. And I suggest to you that we're not going to change that data. We're not going to change the indicators that we care about until we dig deeper beyond this global bucket of poverty to figure out what it is that's going on in their lives and get to the root of what's happening and make a difference in their lives. So here's some of their voices telling their stories themselves. There was like 13 people in that house. After a while, you know, There's not enough food and everything for everybody to be there. One winter, we had no heat. We had no electricity. We had no water. It was bad. People judge me for the way I look all the time. I think it's because I'm Black and I'm tall. I'm walking past cars and people lock their doors. This is out of their mouths. These are direct quotes. What's stressful in my life is being raped and getting pregnant from it. Okay? Kids talked about carrying weapons because they were afraid of either being raped on the way to school or dogs, stray dogs in their neighborhood, et cetera, et cetera. They feared for their lives or their safety on the way to school and on the way home from school, and that was why they were carrying weapons, to protect themselves, to take care of themselves, and then hiding them outside the school because they know they can't get through the metal detector. They hide them so they can protect themselves to school, which, I mean, it means a whole lot that you're willing to do that to get to school, okay? That means school is important and you want to get there. So they're protecting themselves on the way to school to be able to be in school and then get back home, and talked about having been raped on the way to school. They took away the swings and the play skate at the park. There's nothing but a basketball court there, and they don't even have nets. It's irritating and makes me mad. And finally, bring all the rich people back to that particular city so they can fix it up. I would put them in our place to see how it feels to be us and the bottom of the food chains out of the lives of our young people. Thank you.
Well, thank you for that sober and poignant comments. I think at this point we're going to take a 10-minute break. So why don't you go refresh yourselves and come back in 10 minutes, and then we're going to have a dialogue and then ask our co-chairs to finish us up. So please be back in 10 minutes.